Hi, my name is John Platero and I'm the CEO of the National Council for Certified Personal Trainers, and I'm here to talk to you about shin splints. Shin splints are also referred to as tibial stress syndrome, which is really a catch-all term for lower leg pain that occurs below the knee, either on the front outside part of the leg or the inside part of the leg. Shin splints can happen to athletes, runners, tennis players, triathletes, even dancers. They often occur when novice exercisers advance their training too quickly or experienced exercisers abruptly change their workout routine, adding too much mileage, volume, or it could be just from simply mixing it up with some new different type of training. There can be a number of causes of shin splints. Overpronation, an imbalance between the calf muscles and the tibialis anterior, inadequate stretching, worn shoes or excessive stress placed on one leg or hip from running on cambered roads or always running in the same direction. Typically, one leg is involved and it is almost always the dominant one. Right-handed people are usually right-footed, which might just be the leg that's going to hurt. However, in my experience, whenever I've had shin splints, it was always bilateral and always occurred from eccentric deceleration of downhill running or descending stairs. Now, like most athletic injuries, the reason people get shin splints is simply put, too much, too soon. Shin splints occur from small tears in the muscle and inflammation of the periosteum and inflammation of the muscle, or some combination of these. Shin pain doesn't always mean you have shin splints. Other conditions that could sometimes be mistaken for shin splints could be compartment syndrome, which is pain on the anterior or outside part of the lower leg, which is a result from swelling of the muscles within a closed compartment, which creates pressure. Pain in the lower leg could also be a stress fracture, which is a more serious injury than shin splints. A bone scan would be essential for diagnosing a stress fracture. However, there are some clues you can look for that will signal whether or not you should get a bone scan. The pain of a stress fracture is less generalized than that of a shin splint. If you can find a specific spot or sharp pain or tenderness, it may be a sign of a stress fracture. Generally, stress fractures often feel better in the morning because the bone has rested all night. In contrast, shin splints often feel worse in the morning because the soft tissue tightens overnight. Shin splints are also the most painful when dorsiflexing the foot. Now, in thinking of preventing shin splints, in simple terms, it's either the anterior portion of the leg is probably too weak and needs to be strengthened, or the posterior portion of the leg is too tight and needs to be stretched. So let's start with strengthening the front of the tibia. So let's look at the anterior tibialis. What's its main job? Well, to lift the foot in order to take the next step. Is that real heavy? I don't think so. And does this muscle have to lift the foot just once in a while, or does it do it all the time? I'd say millions of times. Then it would seem you don't need to go heavy, but you need to do a good amount of reps. There is a piece of exercise equipment called a DARD, which stands for Dynamic Axial Resistance Device. Just look on the internet and you'll find a bunch of them. I'm fortunate because I have a dorsiflexion machine, and this is how it works. So you just slip your foot in, you get your ankle towards the axis, and then you just lift. You can see you're working the anterior tib. All right? You could also use a dumbbell, but you need to be able to sit a little higher because you have to be able to dangle this dumbbell so that you can dorsiflex. You could also use some tubing, just attach it to something, you know, straight out from your foot, and you can just dorsiflex and plantar flex like that. I'm sure you know a lot of stretches for the calves, but here's a stretch for the anterior tibialis. Just kneel on a soft surface,
like an exercise pad, like this, and then slowly sit back onto your calves and heels, but make sure that your feet are plantar flex so that you're stretching the dorsiflexors. And just go back until you feel some tension in the muscles in the anterior part of the leg. And just hold it for 20 to 30 seconds, relax and repeat it. You could also alternate walking on your heels for 30 seconds of regular just walking. So basically you're dorsiflexing and you're just walking on your heels, right? So you're stretching your calves while you're doing that. If you continue to exercise, run or dance, wrap your leg before you go out. Use either tape or an ACE bandage starting at above the ankle. Remember, you always wrap towards the heart and continuing just below the knee. Keep wrapping your leg until the pain goes away. This could take a while, maybe even up to 6 to 8 weeks. Maybe consider cross-training for a while to let your shins recover. Swim, aquatics. You could even run in the pool or maybe ride a bike. When you resume running or whatever exercise you were doing that caused the pain in the first place, increase slowly, maybe no more than 10% weekly. Make sure you have the correct running or training shoes for your foot type, specifically if you're an overpronator. Severe overpronators may need to see a podiatrist. If you're running, avoid hills and excessively hard surfaces until shin pain goes away completely, then reintroduce them gradually to prevent a reoccurrence. If you frequently run on a track, switch directions. If you are prone to developing shin splints, frequently strengthen the tibialis anterior, like I showed you, and stretch your calves as a preventative measure. I hope that helps. Don't forget, stay fit.